Do you want to know why asking questions is important in selling? Hi, I'm Dr. Germán Gómez and I'm in Valencia, Spain. Today we will talk about why asking questions is important in selling. You will get to know why we have to make some questions and what is the aim of these questions and what we have to find out. Asking questions is part of a whole own course about patient communication. Okay, this course is about selling, but for sure this chapter is also part of a patient communication course. Well, ask questions as much as you can when you're selling. Okay, they hook the mind of the patient. You are in control of a conversation if you ask questions. Okay, so you can direct his mind into a certain direction with the questions you make. Okay, so they hook the mind of the patient. Then they help to discover the needs of the patient. Do you think it is a good idea to know the needs of the patient? Of course it is a good idea. I need to know what he needs from me. So I need to ask. And it helps to gather information you could use later in the sales conversation. When you want to show the value of your treatment. The value of the treatment is higher if it meets exactly the needs of the patient. In order for you to show that the treatment caters or meets the needs of the patient, you need to know the needs of the patient. So you need to ask the patient to explain to you his needs. So you have to ask questions. What questions to ask and how to ask, that's another story. Okay, that is another course. But I will give you some sample questions during this course so that you can at least do something in gathering information. Okay, it's not difficult. But you need to understand, we need these questions to see what the needs of the patients are, and this information we use later when we want to present our solution as to show that this solution is exactly for him. And this raises the value of your solution a lot, because if it is useless for him, the value is zero. Don't mix up value with cost, okay? The cost is a price that you put on the treatment. The value for a patient might be higher than the cost or lower than the cost. If it is lower than the cost, he will not buy. If the value for the patient is higher than the cost, he will buy. So you need to raise the value of your treatment in the eyes of the patient. For that you need the information of what he needs. One of the sales mistakes is that you talk too much in the presentation. Okay? You need to reduce your talk. I repeat this over and over again. You should do 20% of the talking and 80% should do the patient. So you should listen 80% of the times. Okay? You talk too much about features and benefits of the treatment, and this is how it goes, and this explaining how all the treatment are. But what you really should do is to find out what the patient needs, what his pain points are, and so on. So you don't sell with your mouth by talking. You sell with your ears by listening. That's a ground rule of selling. Okay? On what you know about your patient. Concentrate on what you know about your patient. And if you don't know anything, find out. How? With questions. Okay? So, his needs, his pain points, not really pain, it's not a pain point like this. It is what does he want to get rid of? Okay? People, the motivation is much higher to run away from bad things than to run towards good things. So let me explain to you. A patient is more likely to make veneers because he has really bad looking teeth versus because he wants a beautiful smile. You understand the difference, okay? So his pain point is, I have really ugly teeth. And this motivates much more to do something about it than I will get a beautiful smile. This is something they don't really appreciate so much. They appreciate much more to get rid of their pain points. And his why. Why does he do something? Why does he want to do something about it? Okay, so maybe he wants to change his smile, and you think it's because of the large canines, and it's not. It's only because you think it. It's not. That doesn't make it true. So you have to listen and understand why the patient wants to change the smile. Maybe exactly these long canines, he loves them and wants to keep them. So in the new smile, they should be included. But he wants to change something else that maybe for you it's not so important, but for him it's the most important thing. So you take that pain point and you cater to this pain point with your solution. You say, okay, these veneers will make this and this, the pain points of this patient, disappear, and we will keep your long canines, for example. Okay, this is something you have to find out. You have to find out his needs, his pain points, and his why. Why does he want to do something about it? Maybe it's not the same thing that you think in that moment. And of course, you have to find out if he's able and qualified to pay. If he cannot pay, it doesn't make sense to do the treatment, okay, for you. If you cannot pay immediately, you need to look for financial solutions, okay, down payment and then a monthly payment or something like that, third-party financial solutions, something like that, okay? And if he has any kind of urgency, this is what you find out. So his needs, pain points, his why, if he is able and qualified to pay, and if he has any kind of urgency. These things have to be found out with the questions. And listen, and use paper and pen and write it down, okay? Because you want to use exactly these words later when you present your solution. You want to mirror the exact words the patient used when you're going to close. Because if he hears the same words he used, he feels like understood. You understood him completely. You are the first one that really understood why he's doing that, and you are the one that will give him the correct solution. That's the feeling of the patient, okay? So use the same words, exactly. That's why you want to use paper and pen to write down what he says, okay? And by the way, this shows to the patient that you are listening and that you're concentrated in himself. There is no way that you write down something and think about something else. Our brain is not programmed for that. So that means you really are concentrating in the patient words, okay? It's better to use pen and paper as a computer because typing is irritating for most patients. So write it down. Pen and paper, pencil and paper, whatever. But write it down and then use it later in your presentation and in your close. Use these words, okay? Use these words as to show that your treatment is the correct and the best for this patient, because it caters exactly to these words he said. Now, you don't know how to ask or how to continue the questions. Well, new questions come from what the patient is telling you. So he tells you something and then you cook from there. You don't know what to ask. You just say, tell me more about that. Tell me more about that. If you didn't understand what he means, if you think there's something else behind that, tell me more about that. Oh, interesting. Tell me more about that. I see. Tell me more about that. Tell me more about that. And so on. Okay? If you don't know what to ask. That's a good question. To keep the patient talking and telling you all you need to know. If you have all the needs, the pain points, okay? If there is urgency and so on. I hope this video was helpful for you. Thank you very much for your attention. Please subscribe to this channel. Click on the bell, turn on notifications, like this video, share this video, and comment below. Bye.